The Deep Dive. We're the show that takes complex topics, really cuts through the noise, and gives you the essential insights you need. Today, we're diving deep, really deep, into an absolutely vital organ, one we probably don't think about enough, the liver.
That's right.
We've gathered a whole stack of sources, basically like a comprehensive set of medical notes.
Yeah.
These are going to guide us through how this amazing organ works, how doctors actually check its health, and, well, what happens when things unfortunately go wrong.
Yeah.
Our mission today, it's simple, really. We want to give you a shortcut to being genuinely well-informed about liver health. We'll cut through the jargon, highlight those key takeaways, those aha moments, and make sure you leave with a clear understanding, without feeling like you just read a medical textbook.
Definitely. And it's such a worthwhile topic. The liver is, it's truly the body's ultimate multitasker. It juggles an incredible number of jobs.
It really does.
And its health is just so foundational, it supports almost every other system.
Yeah.
So understanding it is, well, it's crucial.
Okay, let's unpack that. Before we even touch on what can go wrong, let's just take a moment to appreciate what an absolute powerhouse the liver is. Seriously. It's like the body's central command and the main cleanup crew, all in one. What are its main jobs, based on our sources?
It's incredible, the sheer scope. Think of it like a central factory, really. First off, it's a major hub for synthesis and production.
Yeah.
It makes critical proteins like albumin that helps keep fluid in your blood vessels and others that are absolutely vital for blood clotting. Plus, it makes cholesterol and triglycerides, important fats your body actually needs.
Right, not always the bad guys people think they are.
Exactly. Then there's storage. The liver acts like a really efficient warehouse. It stores glucose, your main fuel, as glycogen, releasing it when energy is needed. And it holds on to essential vitamins too, B12, folic acid, and the fat-soluble ones, A, D, and K.
So energy reserves and vitamins. Got it. What else?
Digestion support is another big one. It produces bile. Yeah, essential for breaking down and absorbing fats later on in the small intestine. The liver makes it, but your gallbladder is like the little storage tank next door.
Okay.
And of course, probably its most famous role, detoxification.
Right, the filter.
Precisely. It's constantly working, filtering your blood, breaking down potentially harmful stuff like drugs, alcohol, even hormones like insulin after they've done their job.
Wow, okay.
And lastly, crucial for waste management. When your body breaks down protein, it creates ammonia, which is pretty toxic stuff.
Right.
The liver converts that dangerous ammonia into urea, which is much safer. Then your kidneys can easily filter that out in urine. It prevents a nasty buildup that could affect your brain.
That is just an astonishing list of responsibilities.
Yeah.
When you hear it all laid out like that, you realize how completely integral the liver is to nearly every system. It's not just doing one thing. It's involved in practically everything.
Absolutely.
No wonder liver problems can have such widespread effects. So if the liver's doing all this amazing work, how do doctors actually get a snapshot? How do they check on what's happening inside? Our notes mention a whole array of tools.
Yeah, they do. The process of figuring out liver health often kicks off with blood tests. These are like an early warning system.
Okay.
Doctors look at liver enzymes, things like ALT, AST, ALP. You can think of those as little indicators. If their levels are high in the blood, it suggests some liver cells might be damaged or inflamed.
Makes sense.
We also check bilirubin. That's a waste product. If the liver isn't processing it right, levels go up, and that's often what causes jaundice, that yellowing of the skin and eyes. They also look at things like serum protein, especially albumin, to see if the liver's manufacturing capabilities are up to par, and blood urea nitrogen, or BUN. Now, that also reflects kidney function, but very low levels can hint at liver issues. Maybe it's not converting ammonia properly. And of course, there are specific tests for hepatitis viruses or even certain markers like CEA, which might point towards cancers in the wider GI system.
So a simple blood draw can actually reveal quite a lot of crucial clues.
A surprising amount, yes.
But what about actually seeing the liver? Getting a picture that involves imaging, I assume.
Precisely. For a visual check, we have different imaging techniques. Ultrasound is often a first step. It's non-invasive, uses sound waves, gives a good look at the structure of the liver, gallbladder, pancreas, can show blockages or changes.
Okay.
For more detail, there are CT scans of the abdomen. They give those cross-sectional views, really detailed pictures.
Right.
And if there's a specific concern about the bile ducts, those little tubes, doctors might use cholangiography. That usually involves injecting a dye and using X-rays to make the ducts visible.
Dye. So allergies could be an issue there.
Good point. Yes, they always check for allergies, especially to iodine or shellfish, before using those guys.
Okay.
And for an even closer look, maybe even to remove something like a gallstone, there's endoscopy. A scope goes down through your digestive tract. A specialized version is ERCP. That uses a flexible scope to directly visualize the bile and pancreatic ducts. It's very effective, but there's a small risk of pancreatitis afterwards, so patients need careful monitoring.
Pancreatitis, inflammation of the pancreas.
Exactly. It's a known potential complication.
So lots of ways to look inside without cutting someone open. But what if they need the absolute most definitive answer, say, about how much damage there is?
That's when a liver biopsy comes into play. Our sources call it the gold standard or most definitive test for seeing the intensity of an infection or the level of liver damage.
Okay.
It means taking a tiny sample of liver tissue with a needle. It's done carefully, and afterwards, the main focus is preventing bleeding or bile leaking out.
So post-procedure care is really important.
Absolutely critical. Patients are watched closely, vital signs monitored frequently. They often lie on their right side for several hours. That helps put pressure on the site, kind of like a natural bandage. And activity is limited for about 24 hours. Bleeding is the #1 concern.
Makes sense. Are there other sort of related tests?
Yeah, one other important one mentioned is testing stool for occult blood.
Occult meaning hidden.
Exactly. Blood you can't see just by looking. A positive result could mean bleeding somewhere in the digestive tract, could be something benign or, something more serious like a tumor.
And that requires some prep too, doesn't it?
It does. Typically avoiding things like red meat, certain vegetables, vitamin C, and some medications like NSAIDs for a few days beforehand, just to make sure the test is accurate.
Right. It really shows how all these different tests, blood work, imaging, the biopsy, even stool tests, they all fit together to build this comprehensive picture of liver health.
It's like detective work.
Yeah. And it really highlights why following those pre-test instructions is so important. You want the clearest possible picture.
Definitely. Accuracy is key.
Okay, so what happens when things do go wrong? Our sources spend quite a bit of time on cirrhosis. It sounds incredibly serious and irreversible.
It is, unfortunately. Cirrhosis is essentially the end stage of long-term chronic liver damage. It's characterized by extensive scarring fibrosis throughout the liver.
Scarring, like scar tissue replacing healthy tissue.
Exactly. And that scar tissue doesn't work like normal liver tissue. It blocks the flow of blood through the liver, making it hard and, non-functional over time. It disrupts all those jobs we talked about earlier.
What causes that level of damage?
There are several major causes. Chronic heavy alcohol consumption is probably the most well-known, leading to alcoholic cirrhosis, sometimes called Lennox cirrhosis.
Right.
But it can also result from chronic viral hepatitis, like B or C, long-term exposure to certain industrial chemicals or toxins, even some medications if misused, like acetaminophen.
Wow, Tylenol.
Yes, in cases of overdose or chronic misuse. Other causes include biliary diseases, where the bile ducts are damaged, sometimes severe right-sided heart failure, which backs up blood into the liver, and even autoimmune conditions.
So multiple paths can lead to this same endpoint of scarring.
Correct. And once that scarring, that fibrosis is established, it's generally considered irreversible.
Okay, so what would someone notice? What are the signs as this progresses?
Well, often it's quite sneaky at first. In the early stages, the signs might just show up on blood tests. Maybe those liver enzymes are elevated or albumin levels are starting to drop. Someone might feel some vague discomfort or pain in their upper right abdomen because the liver might be enlarged. It might even feel firm if a doctor palpates it.
So subtle initially.
Very. But as the disease gets worse, the symptoms become much more obvious and serious. That scarring really starts to obstruct blood flow into the liver via the portal vein. This causes pressure to build up dramatically. That's portal hypertension.
Okay, high pressure in that vein, what does that lead to?
It has major consequences. That high pressure forces fluid out of the blood vessels into the abdominal cavity. That's cites a significant, often visible swelling of the abdomen due to fluid buildup.
Right, I've heard of that.
It also causes blood to back up into other veins. Veins in the esophagus can swell up like varicose veins. These are called esophageal varices. They're very fragile and can rupture and bleed, which is a life-threatening emergency.
That sounds terrifying.
It is. Other signs start appearing too. Jaundice becomes more pronounced, the yellowing of skin and eyes, because the damaged liver just can't process bilirubin anymore. You might see skin changes like spider angiomas, tiny red spider-like blood vessels, often on the face, neck, and chest. Classic sign of advanced liver disease and portal hypertension.
Okay.
People often experience digestive issues, nausea, loss of appetite, leading to weight loss. Their stools might become pale or clay-colored because bile isn't getting into the intestines, and urine might become dark, like tea-colored.
A lot of interconnected symptoms then.
Yes. And then there's hepatic encephalopathy. This is really serious.
The brain issue you mentioned
Oh,
earlier.
exactly.
Yeah.
It happens because the liver can't detoxify substances, especially ammonia, which then builds up in the blood and affects brain function.
What does that look like?
It can range from subtle things early on, like changes in personality, mood swings, maybe difficulty concentrating, even changes in handwriting.
Wow, handwriting.
Yes, it can be an early sign. As it progresses, you see more confusion, slurred speech, drowsiness, muscle twitching. A classic sign in the later stages is asterexis, that flapping tremor when someone holds their hands out.
The liver flap.
That's the one. In the very advanced stages, people can become lethargic, difficult to rouse, eventually slipping into a coma. They might also develop a distinct musty breath odor called fetor hepaticus, literally breath of the dead.
Goodness. It sounds like a truly devastating progression. Understanding these signs seems critical. What can actually be done to manage cirrhosis?
Management focuses on slowing progression, preventing complications, and treating symptoms because we can't reverse the scarring itself. First step is always trying to eliminate the cause, if possible so. Stop drinking alcohol, treat the underlying hepatitis, avoid liver-toxic substances.
Right.
Then it's about managing the consequences. Daily weights and measuring abdominal girth help monitor fluid retention from ascites. Skincare is important because itching can be severe and the skin can be fragile. Monitoring for bleeding is crucial.
And diet, you mentioned that earlier.
Yes, dietary management is huge. It's usually a balancing act. They often need high calories, maybe 3,000 a day to combat malnutrition. But protein might need to be restricted, maybe low to moderate, especially if encephalopathy is present, to limit ammonia production.
Okay.
Fat intake might be moderated. Sodium is definitely restricted, often quite strictly, to help manage ascites. Interestingly, fluids usually aren't restricted unless liver failure is really severe, right at the end stage.
So low sodium, careful protein, high calories.
And vitamin supplements are key. The liver struggles to store and utilize them, so supplementing with C, K, B-complex vitamins, and folic acid is standard practice.
What about the ascites, the fluid buildup?
Besides the low-sodium diet, diuretics are the mainstay medications, like spironolactone or furosemide, to help the kidneys flush out excess fluid. Careful monitoring of intake and output, weight, and electrolytes is essential.
And if diuretics aren't enough?
Then a paracentesis might be needed. That's where a needle is inserted into the abdomen to drain off the excess fluid. It provides relief, but it's temporary, and carries risks like infection, bleeding, or electrolyte shifts. The patient usually needs to empty their bladder right before, and fluid is removed slowly.
Okay. And you mentioned the bleeding varices being an emergency. How is that handled?
That's an absolute medical emergency. Priority is maintaining the airway, getting IV access quickly. Medications like vasopressin might be used to constrict blood vessels and slow the bleeding. Endoscopic procedures can be done to band or sclerose inject the bleeding veins. In severe cases, a special tube called a Sengstaken-Blakemore tube might be inserted. It has balloons that are inflated inside the esophagus and stomach to put direct pressure on the bleeding varices. It's a temporary measure and requires very careful management, including deflating the balloons periodically to prevent tissue damage.
A really critical intervention.
Extremely. And for managing hepatic encephalopathy, the goal is lowering ammonia. The low-protein diet helps. Medications are key. Lactulose is very common. It works in the gut to pull ammonia from the blood and speeds up bowel movements to get rid of it. It essentially acts as a laxative.
Right.
Sometimes antibiotics like neomycin are used to reduce the amount of ammonia-producing bacteria in the gut. And avoiding drugs that are normally detoxified by the liver is crucial.
That's a really complex picture for managing cirrhosis. Let's switch gears now to another major liver issue, hepatitis. That's inflammation, right?
Exactly. Hepatitis is inflammation of the liver. Most often it's caused by viruses, but toxins or drugs can cause it too.
Okay. And it has stages.
Typically, yes. Viral hepatitis often follows a pattern. There's the prodromal stage, maybe a week long, feels like the flu, maybe some pain in the upper right belly. Then the icteric stage, 2 to 6 weeks, where jaundice appears and symptoms usually worsen. Finally, the convalescent stage, another 2 to 6 weeks where the body recovers and the jaundice fades.
Got it.
Yeah.
Now, the different types, A, B, C, D, E, how do they spread? This seems really important for prevention.
Absolutely crucial. Let's break it down. Hepatitis A is very common. It spreads via the oral fecal route. Meaning ingestion of contaminated food or water. Shellfish is a classic example, or through close personal contact if hygiene isn't great. Our sources have that mnemonic. If it ends in a vowel, it comes from the bowel.
Okay, so A and E.
Exactly. Hepatitis E also spreads fecal-oral, usually through contaminated water.
Got it. What about B, C, and D?
Those are different. Hepatitis B spreads through infected blood and bodily fluids. So, unprotected sex, sharing needles, mother-to-newborn transmission during birth, contact with infected blood, even sharing personal items like razors or toothbrushes potentially. There's a highly effective vaccine for Hep B, recommended for infants and high-risk groups.
And hepatitis C?
Hepatitis C is primarily bloodborne. The main route is sharing needles for injectable substance use. Also contaminated needles in healthcare settings, unsanitary tattoo equipment, and less commonly, sexual contact.
Okay, and D?
Hepatitis D is unique. It can only infect someone who already has hepatitis B. It's like a co-infection. So its transmission routes are the same as Hep B blood and body fluids, particularly IV drug use and sex.
That makes sense. So Hep B vaccine also protects against D, in a way?
Indirectly, yes. If you don't get B, you can't get D.
What are the typical symptoms? Are they different for each type?
There's overlap, but some differences. Hepatitis A is often milder, more like a bad flu. Fatigue, muscle aches, maybe nausea, loss of appetite. Hepatitis B and C can cause more significant symptoms. Profound malaise, maybe light sensitivity, chills, headache, digestive upset, that classic right upper quadrant abdominal pain. Jaundice is common, along with dark urine and pale stools. Itching or pruritus from bile salts building up in the skin can also occur.
And diagnosis? Still blood tests and maybe biopsy?
Yes. Blood tests will show those elevated liver enzymes, ALT, AST, and bilirubin. Specific antibody and antigen tests identify which virus is present. And again, a liver biopsy is considered the most definitive way to assess the level of inflammation and damage.
So if someone gets hepatitis, what's the usual approach?
Yeah.
And how do we prevent it?
For managing acute viral hepatitis, it's largely supportive care for all types. The body usually clears A and E on its own. B and C can become chronic. But the immediate management is rest. Really allowing the liver to heal is key, often bed rest initially.
Okay.
Diet is usually small, frequent meals, typically low in fat, higher in carbohydrates for energy. Protein intake might be moderated if the liver is really struggling. Good hydration is important. Sometimes IV fluids are needed.
Makes sense.
Vitamins are often supplemented. C for healing, B complex to help absorb other vitamins, and K if clotting times are prolonged. And critically, avoiding unnecessary medications, especially alcohol and anything detoxified by the liver.
And prevention. Vaccines are key for A and B.
Absolutely. Vaccines for Hep A and Hep B are very effective. For someone exposed, gamma globulin injections can provide temporary passive immunity. For babies born to Hep B positive mothers, they get both the vaccine and hepatitis B immune globulin, HBIG, right after birth.
Crucial.
And basic public health measures. Good hand washing, especially after using the bathroom and before handling food. Ensuring food and water safety. Safe sex practices. Not sharing needles or personal hygiene items. It covers most bases.
It really emphasizes how much prevention is possible through vaccination and basic hygiene. Now, quickly, our sources also mentioned liver abscesses and cancer.
Right. Briefly, liver abscesses are collections of pus within the liver, usually caused by bacteria getting in somehow. Symptoms are typically fever, chills, pain in the upper right abdomen, maybe jaundice. Treatment involves 5E antibiotics once the specific bacteria is identified, and often draining the abscess, either with a needle or surgically.
Okay, treat the infection, drain the pus.
Pretty much. And then hepatic cancer. The really important point from the sources is that most liver cancer isn't primary. It doesn't start in the liver.
It spreads from elsewhere.
Exactly. It's usually metastatic cancer, often from the colon, lung, or breast. Primary liver cancer does happen, often linked to chronic Hep B or C, cirrhosis, heavy alcohol use, but it's less common than metastatic disease.
And the outlook.
Unfortunately, liver cancer is often found late, and survival rates tend to be low. Symptoms often overlap with advanced cirrhosis, jaundice, ascites, bleeding issues, encephalopathy. Treatment is usually palliative, aimed at slowing growth with radiation or chemotherapy, sometimes surgery. A liver transplant is a possibility, but challenging due to high rates of infection and rejection post-surgery. Patients need lifelong immunosuppressant drugs like cyclosporine.
A tough diagnosis.
Very tough.
Well, we've certainly covered a lot of ground today. We've gone from the liver's absolutely incredible multitasking abilities, really running the show in there, through all the ways doctors monitor its health, and into the serious challenges like cirrhosis, hepatitis, abscesses, and cancer. Our goal was to give you clear, actionable information, cutting through that medical complexity.
And what strikes me looking at all this is just how interconnected everything is. From the basic functions like making proteins to the complex symptoms of cirrhosis like encephalopathy. It really underscores how vital that organ is and how one problem can cascade into many others. The liver's story is really one of amazing resilience, but also significant vulnerability.
That really brings us to a final thought for you, our listener. Considering everything we've unpacked today, the liver's strengths, its weaknesses, the ways we can test it, and the things that can go wrong, what small, maybe manageable steps might you consider taking to support your own liver health? And perhaps more broadly, how can this deeper understanding empower you to listen to your body and engage more effectively with your own health journey? It's something powerful to think about, and we really encourage you to mull that over.